Hello, my name is Courtney Frada, and I'm a DNP student at Franklin University. I met with the nurse scientists at the VA Connecticut healthcare system and discussed a quality improvement project that they just began working on. One of the staff nurses on an inpatient unit came to the nurse scientist and wondered how implementing an ambulation protocol would improve inpatient outcomes. This nurse noted that patients on his unit were only ambulating once a day with their physical therapist during that physical therapy appointment time. And all other times during the day, evening and night shifts, patients were either in the chair, in a wheelchair, or in their beds. The nurse scientist then met with the physical therapy department and the leadership to see if they thought this was in fact what was happening and what their observations were. The physical therapy department concurred and said these patients are really only mobile during that time during the PT appointments. She then met with the unit manager on this nurse's unit, and the nurse manager concurred that this was in fact happening. So this is going to be a project that TIS will, with help of the staff nurse, work on implementing an ambulation protocol just on this unit and see how that impacts patient outcomes. Because this quality improvement project is in its preliminary stages, there's not a whole lot of data surrounding what the risks of the patients right now. And before implementing this project, the unit and the nurse need to really understand what the data is on their unit. They are utilizing the Johns Hopkins Fall Risk Assessment tool, though it's unclear how often it's being used, if it's used with every patient upon admission to the unit, and what the cadence of reassessments are using this tool. There also needs to be data on hospital-acquired pneumonias, ventilator-acquired pneumonias, hospital-acquired pressure ulcers, falls, and falls with any injuries on that unit. We need this data in order to evaluate whether the data is improved once this ambulation protocol is implemented. So the aim of the program is to assess whether an ambulation protocol improves patient mobility and outcomes on this particular unit. And depending on the outcomes, they will consider implementing it on other units at this VA hospital as well. The literature discussed that immobility on inpatients increases the risk of hospital-acquired and ventilator-acquired pneumonias, deep vein thrombosis, hospital-acquired pressure injuries, and increased length of stays. This unit does use the Johns Hopkins Fall Risk Assessment tool, and the literature does note that this is a widely used tool that helps assess fall risk and prevent injuries. And so they are utilizing this tool. The literature also notes that utilizing a standardized ambulation protocol will decrease lengths of stays and increase overall patient well-being. When looking at implementing a quality improvement change such as this, utilizing the Plan, Do, Study, Act model, or PDSA, allows for really detailed and methodical approach to a change project. The team will implement the change and then assess the data and the outcomes. And once the change is implemented, the data is assessed. It allows the team to see what went well, what maybe needs some additional improvements based on that data. So the Plan, Do, Study, Act is a good change model to implement a quality improvement project such as this. We need to look at several outcome measures to evaluate whether this protocol is beneficial to the patients. Do we see improvements in hospital-acquired pneumonias? Are there less falls or less falls with injuries? Are there less hospital-acquired pressure injuries with increasing mobility? We need to look at whether the length of stay for patients has decreased with improving or increasing their mobility. Has the patient's mobility and strength increased during this implementation of protocol? And how is the patient satisfaction? Looking at all of these measures and then evaluating the data and then comparing them to the preliminary data before the change project was implemented will really give a clear picture of how this project worked, what changes maybe need to be made in the protocol, and how that can then be implemented on a larger scale in other units.